Hello, everyone, and welcome. Welcome to the Duke Ophthalmic Technician Information Session. I'm Deborah Smith, and I'm the Program Director. And I will be joined by Dr. Anna Bordelon, who is the Program Medical Director, and two former students, Henry Cameron, class of 2018, and Leanne McKinnon, class of 2011, so that we can share information from different perspectives about the program and the career of an ophthalmic technician. We really appreciate you joining us, and we hope that we can give you some excellent information in a very brief time. And we also welcome you to visit our website, or my email address will be on the last slide, and my phone number where you can contact me if you have more questions. So I thought I would begin by just sharing some of the most frequently asked questions that I get from people contemplating applying for our program. So this slide represents all of the coursework that's required for the first semester and second semester in the ophthalmic technician program. Actually, not all of the coursework is included here because there are some labs and workshops that are associated with some of the first semester and second semester courses that have to be completed as well. But this is certainly most of them. And the first semester is mostly focused on teaching basic skills, the language of this profession, behavior, professional behavior in the clinic, teamwork. And when you've achieved competency in the 8-part eye exam, you begin clinical rotations. The first semester has 372 hours of clinical rotations. And then you begin the second semester. And the second semester is more related to abnormal ocular anatomy or ocular disease and more advanced topics. And you also spend even more time in the clinics with 656 hours of clinical rotations. So this tells you basically what's involved in the program. But I also have questions about how this program will benefit me and or the applicant. So Duke's program is pretty unique in that we have all of the resources available to us at the Duke School of Medicine and the Duke Eye Center, so that you will be, when you complete the program, if you study and do the work, you will be well prepared to sit for the COT examination, certification exam, and pass it. We have just wonderful results from the students that have gone through our program as far as the pass rate. It's over 90%, and the national average is 70%. We prepare you to be a competent professional technician for an ophthalmologist or an ophthalmology group. You'll also be a valued and resourceful, supportive member of an eye care team. And you'll become a compassionate advocate for our patients and for the visually impaired. So you'll also benefit because this is a career that's in demand. And we have an extreme shortage of ophthalmic technicians at this time. So more than 90% of our graduates actually secure a position in an ophthalmology practice in the field prior to graduation. So I get emails every week from practices looking for ophthalmic technicians. So it is a wonderful career if you are looking for stability and satisfaction, job satisfaction. So why is our program special? Well, we're special in many ways. The Duke program is unique in the United States because we are the only one-year ophthalmic technician program in the nation. Most ophthalmic technician programs are 2-year programs, but we are uniquely resourced and we can expose the students to all that's necessary in 1 year or 2 semesters. In North Carolina, we're unique because we're the only COT program in the state, and all of our coursework and clinical rotations are performed at facilities located at Duke or the Duke Eye Center. And we're unique at the Duke School of Medicine because we're the only program through the Duke School of Medicine that you can apply to without an undergraduate degree. So in fact, actually no college level prerequisites are required. If you have a high school diploma, you can apply to our program. It's also unique because it's the most affordable program at the Duke School of Medicine, which leads me to the next question. How much does it cost? Well, if you have insurance, health insurance through another source, the total costs for tuition, campus fees, the books, and the certifying exam totals $11,811. But every student is required to have health insurance. So if you don't have health insurance through another source, you can get health insurance through the program or through the School of Medicine at a fee of $3,605. So that would increase your total tuition to $15,416. We do want you to know that financial assistance is available to you. And if you need a contact person, just contact me and I can put you in touch with our financial aid department. Finally, how do I apply? Well, U.S. citizens and permanent residents who will be 18 years of age within 3 months of the start of a program can apply by submitting the documents that you see here. And we need a completed application with a recent photo, just a copy of your high school diploma or equivalent, and the 250-word essay should cover the topic of why you want to come to the Duke Ophthalmic Technician program and become a certified ophthalmic technician. If you have attended colleges in the past, we do need official college transcripts, and there is a test that you have to take when you apply and be considered, and it is a TEAS, or Test of Essential Academic Skills test, that you need to schedule at a PSI testing center. So that's all you need to do to apply. And we do have 2 deadlines for application. To begin the program in July, our application deadline is April 15th. To begin the program in January, the application deadline is October 15th. So I'm going to turn this session over to Dr. Bordelon now.
Okay. All right. Hello, everyone. Thank you for coming to our session. I'll be talking about what an ophthalmic technician means to an ophthalmologist. I am a surgical comprehensive ophthalmologist at the Duke Eye Center. And I have to say that certified ophthalmic technicians are truly invaluable members of an eye clinic. So without them, I can't effectively and as efficiently see the number of patients that I do. So our COTs perform highly skilled tasks in order to allow ophthalmologists to perform surgery, laser, and care for a high volume of patients. They act as our physician extenders in the eye clinic. The broad functions of an ophthalmic technician include collecting data, administering ophthalmic medications, assisting in ophthalmic surgical procedures, and supervising patients. So COTs are mid-level allied ophthalmic personnel, and they have a broad range of ophthalmic knowledge. In our clinics, our COTs take patient histories. They take detailed ocular histories. They also take medical histories, review medications, allergies, family history, and surgical history with patients. They also perform important parts of the eye exam, including testing for vision. They check eye pressures, pupils, motility. They also perform tests to fit patients with glasses and contact lenses. They also act as ophthalmic surgical assistants. So within the clinic environment, they help some of our LASIK doctors perform LASIK surgery. They help our retina doctors perform retinal injections. And they also help our oculoplastics doctors, for example, perform eyelid surgery. They are also our ophthalmic imaging specialists. So just like we can see out into the world with our eyes, we have lots of technology and equipment that helps us look into someone's eyes. And so in our ophthalmic technicians, they help take photographs of the retina. They do glaucoma screening tests by taking photographs of the optic nerve. They do corneal photographs and external eye photographs. They also perform visual field tests as well. They also can take ultrasounds of the eyes, and they conduct specialized testing for cataract surgery. So which is very important to me as a cataract surgeon. Our COTs take really precise measurements of the eyes, and that helps us predict what type of lens to put in a patient's eye at the time of cataract surgery, which really helps improve a patient's lives and their vision. They also act as ophthalmic scribes, which is very helpful in the clinic setting. This frees me up personally to focus on doing a good exam from my end, and also allowing me to have more face-to-face time with the patient and being able to diagnose and treat them. Some of our patients might feel like this cartoon character. The eye clinic is not a spaceship, but we do have lots of gadgets and gizmos and technology that allows us to examine a patient's eyes. And our COTs, they are experts in performing all of these tests. Our COTs also have a key role in providing compassionate and effective eye care. They are at the front line of making the patient experience caring and positive. So a patient in the waiting room, they'll be called back by our ophthalmic technicians into their exam room for the first part of the eye exam. And that visit really helps to set the tone of the entire patient experience and visit even before they see me. They can help ease the anxiety of a worried patient. They can help listen to a patient's complaints and help them understand what needs to happen. Our technicians know that if someone comes in with a pressure that's elevated, that they'll initiate that extra glaucoma screening test that they need. If a patient has cataract surgery or cataract symptoms, they'll initiate the extra cataract surgery testing that's needed as well. So they can really help a patient get through their eye exam and get to the right diagnosis and treatment. Our COTs also help increase the efficiency for the clinic. By collecting and documenting and reporting data to the ophthalmologist, they allow us to be able to make the right diagnosis and treatment. They can also take their time with patients and help review patient instructions as well. They can facilitate the flow of patients in clinic. They are really absolutely essential to the success of our clinic. Now I'm going to turn this presentation over to some of our former students and current Duke Eye Center employees. So we have Henry Cameron. He was in the class of 2018, and he is a ophthalmic technician at the Duke Eye Center at South Durham. And then later we'll be hearing from Leanne McKinnon. She graduated in 2011, and she's currently healthcare administrator over our Duke Eye Center Winston-Salem satellite.
Good afternoon. How are you all doing? I hope well. I apologize for my video. Something's going on with my laptop, but hopefully you can hear me okay. So I'm here to talk about being an ophthalmic technician, and I got to say, so far, this has been one of my better decisions in my life. I very much value and have enjoyed being a technician so far. The program itself also was actually pretty amazing. I can't lie; it's definitely sometimes definitely a grind, but and a challenge. But one of the best things about overcoming a challenge is how great it makes you feel. And being a technician at South Durham has been a great experience. I love all my coworkers for the most part. Essentially, we all have our up downs and our up days and our bad days, but overall, it's a great family to be part of. Most recently, I've actually been expanding my repertoire as far as photography, ophthalmic photography, and that's just one of the many actual avenues that you could take going through this program and going through this profession. Actually, I never thought photography would be a thing for me, but medical photography is so interesting. The eye has so many different layers, both literally and figuratively, to it, that it's amazing to get to do things such as do various parts of photography, because there's different types of photography as well, as far as ophthalmology is concerned. But it's been a great experience. I most recently just got actually a new certification to advance my photography goals. And again, also very challenging, and a lot to learn, a lot to study, but it has been worthwhile. And again, the more you learn, the more you want to continue to learn in this field, because there's always something new and it's always something interesting. That I'm not sure what else I have to contribute. Again, I just have one portion of ophthalmology. Leanne has probably also had a much different experience, but also a worthwhile experience, I'm presuming, as well. So if it's okay with her, I'm going to go and turn the floor over to her.
Thank you, Henry. So my name is Leanne McKinnon. I had a slightly different experience than Henry, but ultimately everyone kind of ends up in the same field, direction, and then you kind of decide what kind of works best for you. And that's the great part about ophthalmology, is there's so many avenues that you can take. So just to kind of backtrack a bit, I started out in optometry. I was part-time in optometry in high school and really enjoyed that. And through some of the optometrists I worked with, I learned about this program at Duke, the OpTech program. I had no idea what an OpTech was or what that entailed. So I wanted to learn more, found out more, and then applied and was accepted. It was definitely, as Henry said, just a great experience, but one of those things that you need to put your mind to. 51 weeks of book work and rotations in the clinic, which to me was very exciting. In the clinic, you get to be alongside world-renowned surgeons. I even got to go in the OR with multiple surgeons. I think that's a standard rotation for everyone. And kind of during the OpTech program, you get to experience some of everything. So you can kind of go ahead and get an idea of what interests you in regards to subspecialty, or really, it's unlimited options there. So you could even kind of dream up something new that you like and, pitch it to whoever you're interested in kind of presenting that idea to at whatever job you wind up at, and say, hey, I would really like to do photography like Henry, or be a technician and work patients up. So 2011 in the program, so that was a year. And then by the summer, I had already had a job lined up before the program was over, as Deb referenced. And I started working at Duke Eye Center in Winston-Salem. From there, really within, I would say, a year, I was kind of promoted to a team lead for one provider, and that kind of graduated to multiple providers within the clinic. That was me managing staffing, corrective action, scheduling employees off, ordering supplies, things like that. And then within about 2 years after that, I was promoted to the clinic manager of the entire office. So I was in that role from 2015 to actually about a month ago, I was promoted to the Health Center Administrator here at Winston-Salem. So, you know, with that said, you can really take this opportunity and make it whatever you want. If you're very clinical and you want to stay on the floor and work patients up and interact with patients, that is totally something you can do. There's also opportunities for research. If you're interested in things like that, you can, you know, take that avenue, become a research coordinator, or get certified in research, photography like Henry. And then there's also opportunities for leadership and management. As Deb said, there is a shortage right now, especially during the pandemic. And we are finding that, you know, there's just not a lot of staff out there. It's still a specialty or an allied health field that's not as popular as some of the others that are out there right now. If you're looking at local community colleges, you know that, you know, nursing has a wait list, or rad techs have a wait list. So the field is open, and your position can be what you kind of want to make it into. The end point is an ophthalmic technician. But again, if you're interested in taking a certain route or whatever, you can do that. And there are opportunities at Duke, and that in itself is just an amazing opportunity. Some of the things that I learned just working beside and observing beside some of the providers that I got to work with over the years is just, you know, that can never be taken away from me. And those are memories that I'll always have. So yeah, it's been a wild ride. It's been very interesting, and it feels like quite the trajectory in a short time, but you know, you just get passionate about something and then things just kind of off. So if you are interested in finding out more, I would suggest doing so, because this is something that you can definitely just kind of spread your wings in and progress as you wish. All right, so I personally am available for any questions, and I see there's some things in the chat, so I'll look and see if.
Leanne, I can help with those questions.
Okay.
Yeah. So I'm just trying to see. One of our first questions was, during the pandemic, is the daily environment different? Were there layoffs or furloughs in this field?
At Duke, there were no furloughs. They did stagger the staff during the pandemic. The program, there was a lockdown on campus for several weeks, but we continued the lecture series of the program through Zoom hours. So we really didn't miss. We focused on the lecture courses during the shutdown, and then when we came back to campus, we focused on the workshops. And everyone successfully finished the first semester, and also very successfully finished the second semester, and all of our graduates last December passed their certification exam on the first try. So it definitely changes things. We do wear masks and gloves, and we socially distance, and but we're still able to learn. We've got a lot of videos that demonstrate how to do different procedures and how to use different equipment, and we're making use of all the resources that we have to just keep the education going. So I hope that answers your question. Are there other questions?
Yes. So does the program, is it full-time Monday through Friday?
It is full-time, pretty much full-time Monday through Friday. We typically will have a 2 to 3 hour lecture session in the mornings, and then in the afternoon, we'll have about a 3-hour lab. And that's during the initial three months. That's what we call boot camp. And that's when you learn all the basic skills that you need so that you can at least function in a clinical setting. And then after the clinic, after boot camp, then you start in your clinical rotations, and you are in the clinic from basically 8 till 5, Monday through Thursday, and then you come back to the classroom on Fridays. So I think there was a question about working while you're in the program. We have had some students that have worked while they were in the program, but the hours were pretty limited. When the hours when were extended, obviously the academics suffered. So, you know, I would imagine about 12 hours would be about the maximum that someone could work and really maintain all of their academics, because you're on campus all day and then you're reading and studying in the evenings.
Okay.
Any other?
Yeah, the last question is the Duke Employee Tuition Assistance. Does it apply to this program and the certificate?
Employee tuition assistance?
If you're a Duke employee and your child's, I'm assuming their child might be applying.
That question can be addressed by human resources and the manager, because I think it depends on an arrangement that the management makes with the human resource and benefit.
Okay, so they should
contact
their HR rep.
They should, definitely.
Okay. Any other questions? As of right now, I don't see any.
No?
I don't think so. No, ma'am.
Well, thank you for attending. And if you think of any questions in the future, just contact me. I'll be happy to answer any questions that I can, or refer you to whomever you need to be referred to get the answer to your question. So I hope I think we finished pretty much right on time, and you can go and enjoy your evening now. But thank you so much for attending. And I want to thank everyone who joined me today to tell their story about the ophthalmic technicians and the career and the program. So thank you so much, and have a great evening.